Two-time central bank governor and longtime Liberal Mark Carney is taking on a new role with the Liberal Party of Canada after a summer of speculation over whether he'd replace Chrystia Freeland as finance minister. Announced today, Carney will chair the Leaders' Task Force on Economic Growth, a move that comes as he's set to address the gathering Liberal caucus in Nanaimo, British Columbia. It's the first time Liberal MPs have huddled together since the surprise and significant loss of their long-held Toronto St. Paul's seat back in June. Earlier today, I spoke with Health Minister Mark Holland just before he left Toronto for that meeting. Hi, Minister. Good to see you as always. Thanks for making time for the show.
You bet, Vassy.
I have a number of questions related to your portfolio, most particularly dental care, but I did want to start off asking about where I know you're headed, caucus over in Nanaimo, BC. One of your colleagues, Julie Dershowitz, told CTV this weekend, quote, "We're worried, given the end of the deal with the NDP, given the resignation of your campaign director, and given public opinion polls. Are you worried?"
No, no, I'm not. I think that my focus is on the business of being Canada's health minister, and I think our government is focused on the same thing, which is making sure that we help people and that we're focused on governing. Look, things go up, things go down. I think for me, I was there in 04, 06, 08, 11, 15, et cetera, so forth. This will be my 8th federal election. You learn to not get too invested in these ups and downs. You stay focused on what you were elected to do. And we were elected to serve Canadians and get things done, things like dental care, pharmacare. So that's what my focus is, and I don't sort of focus on these up and down machinations.
I think if I were asking you this a year ago, I would totally understand where you're coming from. There was not a persistently wide gap between your party and the Tories. It was not as sustained, not nearly as sustained as it has been over the last 8 months. My guess is that's what's informing Ms. Dershowitz's comments, right, about her worry, is that this isn't the normal up and down. It's been like that for a while. And it also leads me to wonder or sort of assume that Canadians, even though you're governing, don't feel that that governing is effective. Is that fair?
Well, no, I think, look, these are difficult times. I can tell you as I go around the country or as I did events in my riding, that people are concerned about the state of the world. It's very heavy times. And so it's understandable that there's a lot of frustrations there. And what Mr. Poilievre has done is leaned into that, pressed into the pain, made people feel more uncomfortable. And he's good at that. But that's not choosing the direction for a country. That's not choosing the kind of country we want to have. And I think when people take a look at it, who would Canada trade its place with? Canada is in a very difficult global time, doing very well. And we have to have a really important conversation about the choice that's in front of us. Right now, Canadians haven't been focused on a choice. They've been focused on frustrations with the world writ large and understandably frustrations about the challenges that are here at home. But when those get focused into a conversation about what kind of government you want to have, what kind of policies you want to have, what kind of folks do you want focusing on what kind of issues, that's one where I feel very comfortable. And in the conversations that I've been having with people, very easy to get to a place where I see our way to being able to get support. But I mean, I think the focus, again, is in the wrong place. If you're focused on polls, then you're missing the fact that you have an opportunity to be getting things done and to govern. And that's what my focus has been, certainly as health minister. We've got some very big things to get done, things that I'm sure we're going to be talking about in a moment.
We will, yeah. Yes, we will, and I have questions about that. Just one more question on this, because I do take your point about, focusing in, as the Conservatives have done, on those frustrations. But I'm not sure it's as simple as saying it's just frustrations with the way of the world right now, or the state of the world, as you put it. The Canadians I speak with are very frustrated with their own lot in life, their own challenges that they face, the affordability crisis that they have endured for the last 2 years. Don't these polls show something different than you're intimating? Don't they show that people, though you say you are governing, don't feel that that governing has led to better conclusions for their life? And shouldn't you take something from that and provide them maybe with a different agenda, a bigger agenda, more change, rather than what you and your colleagues keep telling us, which is you will continue doing what you're doing?
Well, look, I think in the first order, I acknowledge fully that the times we're living in globally are very difficult. They're probably the most difficult times since the Second World War. But in that, we have to look at what real solutions are, rooted in data and science and evidence. And, and I think when you take a look at the Conservatives as an example, they've offered no policies, no ideas. All we know is they're going to cut. and cut tremendously across the board.
But that doesn't absolve your government from questions about what you're doing.
Absolutely not.
I agree. I would love them to answer that question.
But take a look, Vassy, take a look at how Canada's doing. Take a look at how Canada's doing in terms of job creation, in terms of our
unemployment
GDP,
rate is up.
in terms of our, it is.
GDP
but if
per
you take a look
capita
at it,
is
it's
not
still
up.
very. No, but if you take a look at how we're doing versus the rest of the world across a myriad of economic indicators, Canada is doing exceptionally well. Now, that's in very difficult global times. You could take inflation. Canada has got one of the lowest inflation rates, and I believe it is the lowest in the G7, one of the lowest in the G20, and below all the averages of the G20 and OECD countries. So we're doing very well across a number of metrics. But the question here is, look, it's very easy. I've been around this business a long time. I was in opposition. Going around and hammering the government and saying everything that's wrong in the world is very easy, and you can get a lot of points for it. Here's the problem. You're going to have to come and have a conversation about solutions. How are you making things better? And I would say to you that whether or not it's on housing, whether or not it's on affordability, whether or not it's on health care, that we have concrete plans that we're working through. And I think that you have to stick to the business of getting things done and delivering results. I think trying to find magic wands or trying to herk or jerk here or there to try to change the narrative isn't the way to do it. The way to do it is to get results. The way to do it is to do things like what we're doing with dental care. 650,000 people getting care. Over 80% of dentists now are participating in the program, making sure that we make pharmacare happen, that we get diabetes medication to people. So these are the practical things that I'm focused on. I'm very comfortable having a conversation in 6 months, a year time, about how what we've done and are doing is different than just the anger and noise that has come from the opposition. That isn't a plan.
And I'm certainly
that is the political strategy, but it's not a plan for a country.
I understand that, and I'm not absolving the opposition of answering those questions. In fact, I asked them over and over and over again, largely to no avail. But I also don't think that absolves your government from questions about the things that you are saying you're delivering on, that polling and anecdotally Canadians tell me they don't feel you're delivering on. On dental care, I'm not sure that's one of those, by the way, because you're right, the number of Canadians who have accessed the program are quite high. I wanted to ask about the program going forward and what's left to unfold, because so much of this was done in partnership with the NDP. Can you say for the record, without their partnership on this, now that the formality of the agreement is over, is your government going to follow through on it till the very end?
100%. Look, this was a shared priority. I was House Leader when this government was formed, and we talked about shared priorities and getting things done. Dental care has been something that we've been focused on and lifting and getting done. I've been traveling, and so have my colleagues in every corner of this country, meeting with dental providers and dentists, denturists and hygienists, getting people signed up. That's why we have more than 80% of oral health professionals, including 80% of dentists across the country that have signed up. And now we see 2.4 million Canadians have signed up. And these are real stories, people getting care in a transformative way. It's going to have a huge impact on our health system. And I take a look at what we're going to be doing in pharmacare. 100%. I continue to have conversations with my provincial and territorial colleagues about getting the job done there, or about school food, about making sure that our kids have healthy meals. That has huge implications for our health system as well. So on the health side of things, look, the NDP was a parliamentary partner. They voted for some of these things. But in terms of implementation, that heavy lifting has been our job, and it continues to be our job, and we're going to continue to get it done. You
mentioned pharmacare still before the Senate. Is your government committed to not proroguing Parliament so that whatever legislatively has to get through it still does?
We have the pharmacare legislation in the Senate. I'm very much looking forward to being adopted there. I'm not the House Leader anymore, so you'd have to talk to the House Leader in terms around the parliamentary plan. But in terms of my plan for data, it's so essential that we have interoperability and common data standards across this country so that we can work with provinces and territories on finally cracking data. That's going to save lives. Safe Long-Term Care Act, that's incredibly important for us to move forward with, as well as this pharmacare legislation. So just in my portfolio in health, we have some really critical pieces of legislation. I think it's important important that we focus on that. Canadians expect us in between elections to be focused not on politics, but on getting things done for them. And that's what we're going to continue to do. We have different parliamentary parties that we have shared priorities. We're willing to work with whoever it takes to get it done. But the focus here should be on doing the business of the nation, not trying to angle an edge for an election on a timing that one particular leader or another thinks benefits them.
Do I interpret from that, and I take your point, you're not the House Leader, that your preference would be not to prorogue Parliament? And I'm asking quite genuinely on behalf of Canadians who depend on the stuff that you've talked about, that will depend on the programs making their way through Parliament, who could see all of that put in jeopardy if your government decides to prorogue because they're afraid of the threat of an election. Can you be unequivocal about what you would like to see?
Well, you're the only person who's mentioned to me this idea, so I don't have a lot of thoughts on it. I am not involved in it whatsoever. I mean, the only thing I can tell you is what I've got in front of me and the work that I'm doing, and that we are making incredible headway and progress on dental care, on pharmacare, on transforming our health system. Look, $200 billion invested over the next 10 years in our health system, transforming and revolutionizing primary care, making sure that we have enough doctors and nurses, the work that I said we're doing on data. So I've got an extremely full plate. That's what I wake up and focus my attention on. And I think that's what Canadians want me to be focused on.
Does that mean you wouldn't be in favor of it?
Better. Well, I have nothing to, I don't have any thoughts on it because I've never thought about it. I mean, you're raising it now. You're the first time I've heard it. But my focus is on the work that I've explained.
Okay, I'm going to leave it there. Minister, I appreciate your time as always. Thank you.
Thank you, Vassy.